Hello everyone, in this video we will discuss about IGel and its parts. The IGel is a revolutionary second generation single use supraglottic airway device, and it has a soft gel like non-inflatable cuff made from a medical grade thermoplastic elastomer. Now what are the parts? The parts of an IGel are a non-inflatable anatomically shaped cuff. It is made up of a clear thermoplastic elastomer, and this gel-like cushion mirrors the pharyngeal anatomy. It forms a precise natural seal over the larynx without inflation, and there is no need for inflation monitoring. Now wide bore airway channel, this that you can see over here, this one. This is a rigid transparent stem providing exceptional structure support to prevent kinking. It is a conduit for oxygenation, gas delivery and fiber optic intubation. Now the integral bite block. This has an integral bite block which is a thickened reinforced zone which prevents accidental occlusion if the patient bites during emergence. This is the gastric channel, the small opening that you can see over here. This is the gastric channel. It runs parallel to the airway tube and it is separate from it, and it exits at the mask tip and sits directly over the upper esophagus. This allows continuous venting and also insertion of a gastric suction tube. This is the epiglottis blocker. This is a structural ridge over the mask aperture which prevents the patient's epiglottis from folding backwards and downwards. This is a proximal 15 mm ring connector. It is a standard connector and this connects to the anesthesia circuit. Now what is this? This is a protective cradle, helps maintain the anatomical shape during the storage. It comes like this, packed in this way with the cradle. Now what are the sizes of the IGel? The IGel comes in various sizes from size 1 to size 5. Size 1 is for neonates 2 to 5 kg and no gastric channel. Size 1.5 in infants 5 to 12 kg and it also has no gastric channel. Size 2 is for small child 10 to 25 kg in which a 10 French gastric tube can pass. Size 2.5 is in large child 25 to 35 kg in which a 12 French gastric tube can pass. Size 3 is small adults 30 to 60 kg in which a 12 French gastric tube can pass. Size 4 is for medium adults 50 to 90 kg, 12 French gastric tube can pass, and size 5 is for large adults 90 kg plus in which a 14 French gastric tube can pass. Now what are the indications and contraindications of IGel? Indications are for general anesthesia, routine elective surgical procedures, CPR in unanticipated difficult airway and as a conduit for tracheal intubation. What are the contraindications? The contraindications are severe gastric regurgitation risk, high airway pressure, mouth opening less than 2 centimeters and pharyngeal or esophageal pathology. Now how do we insert the IGel? The IGel is removed from the cradle. A thin layer of lubricant jelly is applied on the posterior surface and then the patient is positioned in the traditional sniffing position. We have to hold the IGel firmly along the integrated bite block. The patient's mouth is opened and the IGel is advanced till we feel a definite resistance is felt, and this black line should lie at the patient's incisors. We have to immediately attach the ventilation circuit and see whether there is symmetrical chest movement, and you can see the clear EtCO2 graph. And after use we have to remove the IGel gently and keep it in the cradle. Thank you and follow for more anesthesia pearls.